Hello everyone. Let us in our presentation study about extraocular muscles, their anatomy and orientation. Thereafter we will be taking on more complex topics, but for the starting and for the first presentation we should know little bit about the anatomy and about the orientation so that we are able to understand how our eye moves basically. So let us begin. What are the learning objectives? Learning objectives will be to describe the detailed anatomy of the extraocular muscles, including their origin, insertion, and the nerve supply. Explain the primary, secondary, and tertiary actions with respect to the orbital axis. Correlate muscle actions with clinical examination of ocular movements and understand common cranial nerve palsies affecting the extraocular muscles. Coming on to the overview of extraocular muscles, there are six extraocular muscles responsible for the voluntary eye movements and binocular vision. There are four rectus, superior, inferior, medial, lateral rectus, and two obliques, superior and inferior obliques. These muscles act in a coordinated manner to allow various movements of the eye, which include elevation, depression, abduction, adduction, and torsional movement of the eyeball. Now, first of all, let us start about learning the general anatomy of the rectus muscles. So you can see here the rectus muscles origin from this annulus of Zinn, which is a common tendinous ring. They get inserted onto the sclera, anterior part of the sclera. First, we are talking about the rectus muscles. So they get inserted onto the anterior sclera, and their rectus means straight, and their hence their orientation is straight. Coming on to the individual rectus muscles and the actions. So medial rectus and lateral rectus, they are parallel to the optical axis of the eyeball. So as I have already mentioned here, the medial and lateral rectus muscles are almost parallel to the optical axis of the eyeball. So they have got only the main action. That is, medial rectus helps in adduction and lateral rectus helps in abduction, abduction and adduction by the medial rectus. All right. Medial rectus is supplied by the third oculomotor nerve and lateral rectus is supplied by the sixth nerve, that is the abducens nerve. Another thing we need to remember is the distance from the limbus at which they are inserted. So we start from medial rectus, then inferior rectus, then the lateral rectus, then the superior rectus. Medial rectus is inserted at a distance of around 5.5 mm, then inferior rectus at 6.6 mm, then lateral rectus 7 mm, and then the superior rectus 7.75 mm. All right. Now coming on to the superior rectus and inferior rectus. Superior rectus and inferior rectus, they are inserted at an angle of 23 degrees to the visual axis. That is why we have got primary, secondary and tertiary actions in the superior rectus as well as the inferior rectus. The medial and the lateral rectus were inserted parallel to the optical axis or the visual axis. So that is why there was only one action, that was the primary action. Secondary and tertiary actions are attributed to their varying degrees of insertion with the visual axis, which in the case of superior and inferior rectus is 23 degrees. Okay, so the primary action of superior rectus is elevation, secondary is the intorsion, and the tertiary is the adduction supplied by the third cranial nerve. Inferior rectus primary action is the depression, secondary is the extorsion, and tertiary is the adduction. And this is also supplied by the third cranial nerve. Coming on to the oblique muscles, and let us learn their general anatomy. So oblique muscles, first of all, superior oblique and inferior oblique, we have two muscles. Let us learn something about superior oblique. Superior oblique, it is arises from the body of the sphenoid and it passes through the trochlea superiorly, and then it gets inserted into the sclera posterior to the equator. Similarly, inferior oblique muscle is the only muscle that arises from the orbital floor, that is anterior maxilla, gets inserted into the posterior sclera inferiorly and posterior to the sclera, right? Posterior to the equator, sorry, posterior to the equator. Now, what I have summed for you guys is the differences between the superior oblique and inferior oblique muscles, which will help you summarize and learn, and then after learning and apply your knowledge in a very systematic way. So let us not forget this diagram. This diagram is very important because if you remember this diagram, then it will be very easy for all of us to remember the muscles, their insertion, and as well as their action. If we remember their insertion, at what angle they are inserted, then we don't have to mug up the secondary and the tertiary actions of these muscles. So let us learn with me. Superior oblique, it arises from the body of the sphenoid above and medial to the optic canal. It runs forward. You can see this runs forward, becomes a tendon, and when passes through the trochlea and then gets inserted and then turns backwards. It turns backwards to get inserted where at the upper outer sclera posterior to the equator. So this is posterior to the equator. Now if we come on to the inferior oblique muscle, so it arises from here. So this is the orbital surface of the maxilla just lateral to the lacrimal fossa, runs laterally and backward directly, and there is no pulley involved and there is no trochlea, and it gets inserted into the lower outer sclera posterior to the equator. All right, so now when we have learnt their insertion, so let us study their primary, secondary and the tertiary actions, right? First of all, we will focus on superior oblique. Superior oblique gets inserted posterior to the equator, right? But superiorly. So the first action will be intorsion, and the secondary actions will be depression, and tertiary action will be abduction. Similarly, with inferior oblique, the primary action will be extorsion and the secondary action will be the elevation and the tertiary will be the abduction. So, action of the superior oblique when the eye is adducted is it is a depressor, and in the inferior oblique it is the elevator. Nerve supply of the superior oblique is by the trochlear, that is the fourth cranial nerve, and inferior oblique is supplied by the oculomotor nerve, that is the third cranial nerve. Unique feature of superior oblique muscle is it is the only muscle with a pulley, and it is the only extraocular muscle which is supplied by the fourth cranial nerve. And inferior oblique, one unique feature is it is the only extraocular muscle that arises from the anterior orbit, that is the orbital surface of the maxilla. All right. Now coming on to the orientation of oblique muscles, this is again very important. I have again highlighted the point. If we remember the orientation of the muscles in our mind, then it will be very easy for us to remember their actions. So let us begin. The superior and inferior oblique muscles insert posterior to the equator of the eyeball, as I have already outlined. Their line of pull is oblique, which is very important. This word oblique is very important. Since they are oblique muscles, this means their line of pull is also oblique to the visual axis. Now how much oblique, this we will be discussing later. Their line of pull is oblique to the visual axis in the primary position. Therefore in primary position they produce mixed actions: vertical movement, torsion and the abduction. This diagram is again very important. You can see in this diagram, this is the superior rectus muscle, right? So this is the superior rectus muscle. It is oriented at an angle of 23 degrees to the visual axis. All right. So this is the visual axis and this is the orientation of the insertion of the superior rectus. Now when we look at the image B, this is the superior oblique, this is the trochlea and this is the insertion. This is the visual axis, right? This is the fovea, so this is the visual axis. So superior oblique is inserted at an angle of 53 degrees to the visual axis. So what does that mean? So let us read what I have already written. Superior and inferior rectus muscles make an angle of 23 degrees and the reflective tendons of the superior and inferior oblique muscles make an angle of 51 degrees with the optical axis in the primary position. So they have subsidiary actions in addition to the main action which I have already highlighted. So primary action of superior oblique is the intorsion, secondary is depression and the tertiary is the abduction. Inferior oblique primary action is the extorsion, secondary is elevation and tertiary is the abduction. All right. Now coming on to the summary of all the muscles with their primary action and the secondary the tertiary actions, right? So we all know medial rectus, they have adduction and abduction respectively. Superior rectus has a primary action of elevation, other actions are the secondary action is intorsion and the tertiary action is the adduction. Similarly inferior rectus Main action is depression, primary action, secondary is extortion, and tertiary is adduction. Superior oblique in primary action is intorsion, as we all know. Second is depression, secondary action, and tertiary action is abduction. Inferior oblique, the main action, primary action is extortion. The other actions include the secondary action, which is the elevation, and the tertiary action, which is the abduction. How to check the extraocular muscles movement? It is known as an H pattern test. So how we check it? In which gaze we check which muscle? It is described very well by this diagram. So superior rectus, superior oblique, and inferior rectus are checked in this gaze, and then in this gaze lateral rectus, medial rectus, and the inferior oblique are checked in the gazes which have been already shown. We will talk about this later in our future presentations. So first of all, this is just an orientation for you guys to help us understand it in a much better way. Rectus muscles, they are tested in abduction. Oblique muscles, they are tested in adduction. All right. So now, if the third cranial nerve, it supplies the all the extraocular muscles except the superior oblique and the lateral rectus. So if it gets affected, all extraocular muscles get affected along with the levator palpebral superioris. So if this nerve gets affected, the eye position will be down and out, and key feature will be ptosis and the dilated pupil. If there is malfunctioning of the fourth cranial nerve, superior oblique is involved, there will be slight elevation, there will be vertical diplopia along with the head tilt. If sixth cranial nerve is involved, the muscle affected will be the lateral rectus muscle, there will be medial deviation of the eye, and there is loss of abduction. Now coming on to the clinical correlations, this I've already told. All remaining extraocular muscles supplied by third nerve, superior oblique is supplied by the fourth cranial nerve, and lateral rectus is supplied by the sixth cranial nerve. This is a clinical correlation. Now in this table, what I have tried to summarize is the origin, insertion along with the nerve supply, primary actions, secondary actions, and their actions in adduction. All right, so this is very important. We all know superior oblique and inferior oblique, they are evaluated when the eye is adducted. So why a superior oblique is a depressor when the eye is adducted? Why? Because when the eye is adducted, the visual axis and the axis of the action of the superior oblique is in the same direction. So that is why it acts as a depressor. Similarly, we have an inferior oblique which elevates when eye is adducted. All right. Now we all know medial rectus and lateral rectus, they have primary action which is adduction and abduction respectively. For superior rectus and inferior rectus, we have primary action of elevation and depression, as we all know, but these muscles are checked in abduction. All right, so if they are in abduction, they are elevator, pure elevators, and if this is in abduction, this is a pure depressor. So rest all I have already discussed. You can pause this slide and write this table. This is a table which helps you summarize all the extraocular muscles with the origin, insertion, and action, and in which gaze they are tested. All right, and the concept behind this I have already told you. So to summarize, recti muscles arise from the common tendinous ring. They insert anterior to the equator and they are tested in abduction. Oblique muscles insert behind the equator. They cause torsional movements, and most effective, they are tested in adduction. All right. So very much thank you. I will look forward for your comments as well as any improvement in the way of presentation, and let us meet you in the next presentation. Very much thank you for your kind attention.